surgery though. All right, so let's get into it. I promised you a framework for making that tough decision. All right, and I'm going to give you a framework. And I got to make sure you guys understand I'm not a doctor. I don't have an MD. I don't have a PhD. I don't have a DC. I don't have a doctor of physical therapy. I'm not even a licensed health professional. Okay. Even if I was, I want you to understand this. You make your decision. Even if I had a doctorate in all of those, and I told you, you need to have surgery, it's still your decision. It's your body, it's your decision. And I'm not doing this to be a pushback guy or anything like that. It's just the reality. And I think it's important that if you're making this decision, that you make it from an informed place. And so if that makes sense to you, let me know, comment, follow, that you follow me, that what we're talking about is how to make a decision, not how to be told what to do. All right, I'm not here to tell you what to do. So I will say that I have been part of helping people year after year to defy the odds they've been given and return to an active, healthy lifestyle without surgery. Okay. And so that might sound like a sales pitch to you. It's reality. And I have also worked with a number of clients who do decide to have surgery, and I've been there to help them to make sure they have a better and more successful outcome. All right. So I'm not here to say no to surgery, and you'll get the vibe on my approach as we go. The more important thing is, what's your vibe? Okay. Yeah, David, possibly the hardest decision I've ever been faced with. It is such a tough decision. That's why I want to make sure we give it the respect. So I'm going to get into that. Um, so yeah, and I will say, okay, hey, if you'd like to know more about how I work with people and all of that, uh, great, reach out to me. But also, if you're looking for more resources and you haven't yet, because I'm doing this is on my profile, I do support a free and private Facebook community called Disc and Nerve Recovery Fundamentals. If you want access to that, comment link. I'll get you the link. We'll get you in there and we'll get you started down the path of looking at what matters most to you and figuring out how to help you take that first best step forward towards your recovery or towards your surgery preparation. So we're going to get in. I'm foreshadowing now. Okay. So the question is, which are you? Are you having surgery or not? Okay. And so I said a framework. This is a big decision framework. Okay. How do you decide? How do you decide? Okay. If you're following along, if you want to follow along, comment decision, because this is where we're at. Okay. I'm going to make it really simple. There's two things you really want to consider before you choose to have surgery. Okay. One is your values. And I don't mean good versus bad. I mean good versus gooder versus goodest. Okay. And that'll get more clear as we go along. So it's called rank ordering your values. It's never tough to decide between good and bad. And we hope that we can see that clarity for something like deciding to have surgery, but it's rarely that clear. It's kind of this rank order situation. And if you don't have your values rank ordered, it's going to be tougher to make that decision. It's going to be tougher to feel good about that decision. Okay. So if you need help with that, comment chat. I'll reach out. We'll have a chat. I'll help you with a process for getting more clear about your values. All right. So the other thing to consider here are your beliefs. Okay, what are your beliefs? And I'm going to try and make this really simple. I hope you're taking notes if this matters to you. So beliefs, I'm going to put it in three basic camps. Okay, so there's the natural camp. Okay, your beliefs are that avoiding the knife, the needle, the pill, etc., is really a big deal to you. That's at the top of your rank ordered list. Okay, that may be you. If that's you, fantastic. Okay, we'll talk about what that means for you though in terms of how you approach recovery. Okay, so that's camp number one. Camp number two is intervention. Okay, so that means you're open to knife, needle, pill, but you want to kind of give them a rank ordering, mild to mid to the deep dive. And so you want to to do what's appropriate, but not too much. Okay. For you, if the image that you got, like if you got some imaging and it doesn't look good, oh, sorry, there's another camp. Sorry. So the third camp is, and this is a kind of mindset. If the image doesn't look good, I need to fix it. Okay. If the image doesn't look good, I need to fix it. So if you follow me on those three things, on those three camps, right? There's the natural and there's a natural approach, the intervention approach. I'm willing to look at it, but we need to really put it on this scale. And there's the, if I see a bad image, I want it fixed. If you follow me on that, comment follow. Help me understand where you're at so I can help you. All right. So I'm going back, I'm going to talk about values, but you're going to see how it relates to these beliefs. Okay. So if your value is to avoid surgery at all costs, then it's a pretty simple decision. You want to exhaust every single option first. And the reality on that is that can bump up against the next value, which is comfort. So if your value is to avoid surgery is higher than your value for immediate comfort, then realize that can take some time. Okay. It took me years to really sort through how to take care of my disc issues so that I don't really have issues with my lumbar disc anymore. I don't really have issues with my cervical disc, my thoracic disc. Anything that I feel now, I'm able to intervene quickly and move it the other direction. Whereas before, it might take me weeks. I had a cervical injury that took me a year and a half to work my way through to where I could really get back to the things I love, the way that I love to do them. Okay. Now I'm here to help shorten that curve for you guys, but if your value is to avoid it, then what I feel like you're committing to is to exhaust every other option you can and just deep breath. That's going to take some time. Okay. So what you might want to invest in to get started are some soothing strategies to help you in the interim. Some ways to kind of like lessen that pain, some ways to reduce that pain, some ways that if it hits you hard, you can create a gap for yourself so that you can continue to down your path of discovery. Okay. If that's you, if you're the avoid it at all cost, and you're wondering about how to walk that path, comment, chat. I'm happy to reach out and have a conversation with you and see where you're at and what your next best step might actually be. Now, I've mentioned already the next value that you may have is comfort, right? You're like, okay, I just can't deal with pain. And you know, there's no finger pointing here. If that's you, that's you. It's okay. So we have to see, like, is that, if that's you and you want to avoid surgery, you have to at some point kind of decide which one's where, right? Which one's where. But if the comfort is higher and you can't find comfort, then my thoughts are, one, you want to exhaust research into the risks. So I see a lot of people who want comfort and they jump into a surgery, and then I end up talking to them afterwards and they regret it. I'll talk to you about what you want to avoid so that you don't regret it if that is the decision you do make. Okay. So one of the things that you want to make sure you check on, because you just don't always get told this. You'd hope that you would hear this, but all too often I talk to people who find out afterwards. And I had a surgery on my heart not long ago. And I really wish I would have had a longer conversation about the risk of death, because I thought it was during the surgery. It was for 6 weeks after. Nobody told me that. And you'd think that somebody would have said that ahead of time, but they don't. And I get it. They don't want to get into too big of a conversation. And if you're willing to accept the risk, hey, sign the paper. And I'm not saying that surgeons and medical people aren't caring. Absolutely. I've met some of the most wonderful, caring people in that field. I've also met some really wicked salespeople. So the next part is If you value comfort and you really feel like, yeah, I'd love to see a surgery solve this for me, that would be just great. Make sure to check on the success rate of the doctor you're interviewing. There are ways you can look at that. Okay, there are ways you can look at the outcomes that a doctor may have, but also for the surgery, make sure you check on the outcomes for the particular surgery. A lot of surgeries are there to just fix stuff, but they make zero promises about your comfort level afterwards. But you might not hear that ahead of time. You might have the surgery thinking that because I fixed that, I'm supposed to have this comfort, but that's not always the case. Okay, so surgeons look at things with a surgical brain. I repair that, not necessarily your experience. Okay. Another thing you want to make sure to take a look at is the recovery expectations for the length of recovery. Okay. How long might it take to recover from the particular surgery you're looking at? Let's be real, folks. A surgery, thanks, David. A surgery is an injury. It's a purposeful, directed injury. Okay. But if you think that, well, I'll talk about this in a minute, because there's another value level we want to talk about. But right now, make sure you get an idea for what it might take to recover. Okay. And also, if what you're hoping is to get back to the things you want to do, make sure you clarify what it is you need to do. And is this surgery going to allow me to do that? Because if you just get a repair for repair's sake, it doesn't deliver you what you actually got the repair for, you're going to feel pretty frustrated, pretty broken, possibly after getting that done and spending that money and that time and recovery and everything. And then you come out and you're like, oh, wait, this isn't going to let me do what I want to do. You want to find that out ahead of time. Hey, if this is like, Jeff, this is piling up in my brain, okay, and you want to sift it through, you can rewatch this, okay? Just comment replay. I'll get you the recording, or you can comment chat. I'll reach out and we can walk through things. Okay, so there's another layer of value here, and it's the value of image looks bad, fix image. Okay, image looks bad, fix image. I'm being kind of goofy there, but a lot of people believe that, and it's not because you're not smart. It's because that's what's been told to you. That's what's been presented to you. That's the theory that's been given your way, or you had a friend and it worked for them. Okay, that's not good science, and science gets a bad name these days. But the reality about the scientific method is it's very practical. And what I mean is that repair, is that fix going to deliver the result you want? Or is it just going to quote unquote fix the problem? Now, I almost mentioned this before, but I wanted to save it for this spot. Okay. So if your mindset is repair, fix, I want you to take a look at images of before surgery and after surgery, because most people don't realize that imaging will likely look almost as ugly or even more messy than what was there before. Okay, surgeries aren't pretty. Okay, it's kind of like now no offense to surgeons, they're doing incredibly skillful work and they work their whole lives to do it. But it's not a really pretty result. Like, if you're looking for some artwork, surgeons are usually not the ones to look at, because what they're going to do is they're going to try and tie that thing off, bolt it down, tie it together as best they can based on what they know about how well this is going to hold up, not necessarily on how good are you going to feel. Okay, so if your value is repair image, fix image, I just want to make sure that you're clear about the image ain't going to look pretty, surgery or no surgery. So yeah, so David, hey, thanks so much. He said brilliant advice going on here, so thank you. This has been many years, many conversations, many people helped, many people helped out of surgery, and many people helped through surgery. And I just don't think there's a good place to get this information. There's not one spot, a one-stop shop. And so that's actually what I'm trying to do, is create a little one-stop shop for you guys. And then also This is important. I love that you commented this, David. I was terrified when I was looking at images of cervical fusions. So images are compelling. Images are compelling. You see an image and you think, oh, that's broken, right? I want to take it to the mechanic and get it fixed. What David pointed out, he looked at what the fix looks like, and it can be terrifying. It can work if what work means to you is what work means to the surgeon. You want to make sure those two things are as close to identical as possible. And I want to say this, whether you have surgery or not, you will now bear the burden. And I say burden because it means work. It doesn't mean woe is me. It means you will bear the burden. You will have to do the work to recover the function. You are always going to have to recover the function. Whether you choose to have surgery or not, you are going to have to recover the function. Okay. And there's a way to do that without surgery, and there's a way to do that with surgery. Now, there's a beautiful place where they come together. I'm going to tell you about that. So stay tuned if you're curious about that. And if this like makes the back of your brain start to squeeze and your head hurt and all this, comment, chat. I'll reach out. I'll speak specifically to you and we'll walk you through things. I also promised you guys red flags that you may truly need surgery. And so, hey, I lean on the professionals. You can get different lists from different folks, but this list is pretty basic, and this is one that I've heard a number of times. My clients have come back with, and when I've talked to healthcare professionals, this list stands up pretty good. You make your own list. If you there's people whose mindset is I need to hear what you have, and then I'm going to dig in deeper. Great. There's people who like just tell me what you hear. Great. I'm going to tell you what I've heard and what I understand. Okay. So one red flag, you may truly need it. It can be pain, right? If there is a severe pain that makes it difficult to move, stand, walk, function, think, if it's overwhelming to the point you don't know what to do with yourself, and you've tried some interventions and nothing has taken that pain away and you just can't take it, another attempt might be surgery. Okay, again, I still think you want the list. Is this going to solve the pain problem or just the image problem? Okay, so another thing could be pain that worsens or doesn't fade over time. May indicate a need for medical attention, of course. If it's intolerable, it may indicate surgery. We've kind of just mentioned this. And I want to like put the stamp on this point. As long as the likelihood of relief is high, as long as the likelihood of relief is high. So comment follow if you follow me. All right. Nerve pressure, right? Numbness, weakness, muscle loss caused by something pressing on a nerve that can't be dealt with otherwise. That's key. If that pressure can't be dealt with otherwise, because there's a whole lot of ways to deal with pressure. There's a whole lot of ways to help you get past that pressure problem. Compression is one of the three things that irritate nerves. And so if you want to know more about those three things that irritate nerves, comment nerve resource, and I'll get that to you so you can understand better what happens to nerves. So other symptoms that can come up, difficulty controlling the bladder or bowels. And by that, I mean like loss of control. I don't mean like pressure going, hey, I'm 53. I got to go more often than I used to. It's not because of disc problems. All right. There's other things that come up that can create urgency. But what we're talking about is where all of a sudden I don't have any control of those muscles. A progressive weakness, muscle loss, new or progressive myelopathy, which can indicate compression of the spinal cord. So, hey, if we know there's spinal cord compression, there's some risks involved with that. Paralysis being one. And so if there's spinal cord compression, there's a big conversation about surgery that probably needs to be had pretty quick. All right. So I hope those are helpful. There's a little bit more here. So time can play a part. So, so the standard is symptoms that have lasted 6 weeks and don't improve with other treatments. So if you feel like you have exhausted all your options in 6 weeks and you haven't had improvement, maybe you consider surgery. I personally have found that 6 weeks is a really fast time to try and run through other options. More like 6 months or a year of running through options for me for a number of issues. So you may also need surgery if you need to get better quickly for work or other reasons, right? If you need to get better quickly and I really don't have time to work through this process, I'm going to put the stamp on it again. As long as the likelihood of relief is high, as long as the result you're really looking for is the result that this surgery delivers at a high percentage rate, then to me, that can make a better decision. Hey, if you follow me, say, got it. Okay. Tell me, got it, if you got it. Right. I promised you one more thing, guys. I know this is a long one, but hey, this is a big topic and an important topic. So I said, how you can make sure you have your fastest, fullest, and best recovery if you do decide to have surgery. Okay. Many people think I go have the surgery, then I start recovery. Guess what? If you do the work before the surgery, the recovery time tends to shrink much more dramatically than if you start to do the work after the surgery. Now, that can feel very frustrating because you can feel like, oh man, I got to do this work before the surgery. Then I had the surgery, then I got to do the work after the surgery. I'm just going to wait. So, the work you need to do as surgery prep is the same work you would do as surgery prevention. They're really no different. So, if you were hoping to avoid surgery, you would be doing the same work before that surgery anyway. You would be doing that work to avoid the surgery. So I have literally many times had clients who had a surgery scheduled and we start doing the surgery prep work. They get pain-free, they get fully functional. Now, a few of them cancel the surgery on their own, and a few of them had the surgeon cancel the surgery as unethical. The surgeon said, hey, you're feeling too good. I know we had those images. I know what I told you. I know I said that we needed to do this, but you're functioning at too high of a level. It doesn't make sense to do this. Clearly, the function delivered for you even better than I thought this surgery might. So stick with that. If you need me, I'm here. Okay. If that makes sense to you, that doing surgery prep before surgery could yield many layers of benefit, comment sense for me. Comment sense, S-E-N-S-E. So we're following. All right. Again, same kind of thing here. If surgery prep, if you're like, I don't know what that is. Surgery prevention, I have no idea. I've tried all these things. I don't know what to do. Comment chat. Okay. I do offer services and they are unique and they are designed to be comprehensive. Most therapies will get you out of pain. That's the target. And then you're left in what's called the critical phase, which means you're much more likely to get re-injured as opposed to working you through that, getting you to the point where you're in the functional phase, which means you can have a real confidence with your result. Okay. This is the path that I had to learn to follow, and I'd love to help you learn to follow as I have for many, many clients. If you're interested in any of that, comment, chat. I'll reach out to you. Doesn't matter if this is now or in the future, but I will say, hey, if you tag me, I'm going to be much more likely to see your response. Sometimes Facebook doesn't let me see responses, especially if it's an older resource. If you're checking this out and we're not friends, friend request me because otherwise I may not be able to see your tag. Okay, hopefully you found this helpful. If you did, help me understand. I put a lot of work into this. I put a lot of years into this. I want to make sure I'm delivering what you're looking for. Otherwise, it's just me sitting here talking. So comment helpful. Let me know if this feels helpful. If you feel like, hey, I want to see more stuff. I'm really curious. Comment more. Tag me, please. That helps. And if all of this is just like, Jeff, I can't even take this in. I've got so much pain or I've got so much frustration or I don't really see hope. and you'd like to see if there might be some hope, comment support. Okay, support, and I'll reach out. Thank you all so very much for being here. David, thanks so much for jumping in, buddy, and being the participant. For all the rest of you who didn't participate, it's not shame on you. And I want you to understand, participating in these things generates momentum. Momentum wins. You need momentum in order to move forward. All right, sitting still, you got to overcome momentum. So find something to start moving yourself forward. If it's not me, find another resource. But if it is me, I'd be so excited to talk to you.